Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We're live in studio on this very bitter cold day. We're supposed to start getting a little warmer, but apparently not so much. Give me a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're broadcasting to you from 105.9 FM and AM 630 WMAL. Have a very special program and a very special guest in studio for your edification and knowledge, and also will be your presenter at the Roselle Center for Healing this Wednesday, the 25th of February, or is it 28th of February? 25th of February, at 7:30 p.m. Dr. Jennifer Sims will be presenting Uniquely Feminine. We're going to be talking about hormones and balancing hormones naturally, and that's what we're going to do a little bit of today. She is brilliant, she's amazing, she is cutting edge, and this is a class that this Wednesday evening, if you want to figure out how to change what's going on with you? You know, the American standard of perimenopause and menopause and the hot flashes and I don't feel good and my energy's gone down, I have no libido, all of those things, and you see your body begin to deteriorate, they can be stopped because your body wasn't meant to do that. It was meant to just transition into just another phase of your life. But unfortunately, because of Western society, we don't do that. So having said that, good afternoon, Dr. Jen.
Good afternoon.
Sometimes I feel like, there's so many different things I want to say about you because you have capacity and you've proven yourself time and time again to be able to help so many people. This is an area that I know that is very close to your heart because your practice is focused into two areas, women and children, and it's one of those things that, we talk about all the time, but most people don't realize that the natural ebb and flow of where we are in our lives, ladies, we're talking about you right now, is something that shouldn't go bang. It should be just a nice, easy wind flow from one to the other. Let's talk about it for a minute. This Wednesday evening, the 28th, 7:30, I know you're going to get in depth, but for right now, what happens to women in our society, Dr. Jen? Why do women have such profound problems in Western civilization where in some parts of the world it doesn't exist?
Oh, it feels like we have the same conversation all the time, right? A lot of it's diet, right? The American diet has gotten to be so processed. We have created a society of estrogen-dominant women. In other cultures and other countries, they don't have a lot of the same hormonal health issues that we have, although that's changing because of the influence of the American diet on other cultures like China, Japan. McDonald's are going up everywhere. Everybody needs some hydrogenated, genetically modified foods to get them going, apparently. So a lot of it's diet. We create a society of estrogen dominance through what we're eating.
Well, is it just diet? Is it diet and, we have stress factors here in the United States
Sure.
that we don't have anyplace else. We have burdens, lack of exercise, lack of activity. It's a combination, I would think.
It definitely is a combination, and I definitely think also it depends on your level of exercise. You're right, your level of stress, how you process stress, how many fat cells you have in your body. There's a lot of things that go into hormone balance and an imbalance.
Menopause is described basically as the cessation of a menstrual period, and by definition.
Well, by definition, it's the cessation of a menstrual period for 12 consecutive months. That means if you spot, you are not in menopause. If you have 1 month where you have a period, but the 11 months you don't, you are not in menopause. It's a very specific definition because what I find is a lot of women think that they're in menopause, and they're actually not. They're in perimenopause or they're in a different phase.
In this country, we start seeing the onset of perimenopause. We start seeing it around late 40s, early 50s. That's when it should start. But slowly, and actually as we're getting stronger as a species, it should even go longer than that. We have women today that in our practice are having their first children at 39, 40, 41 years old, which years ago that was unheard of. And traditional medical sense would say this is a high-risk pregnancy. No longer is that the case. But we have so many things, from cystic ovaries to endometrial problems to fibroids, and they all seem to be part of this. Even polycystic ovary syndrome, which is, everybody puts up the flag, oh my God, we got a problem here. The truth of it is that women go through transition, but there should be balance in the transition. Take us through a process of why women end up having all of these problems. We said diet and so forth, but let's do something different. Let's kind of take a typical woman and kind of predict what her outcome is going to be.
Okay, so really young, a lot of women start off in the hormonal world as well as, you have bad diet, which we've talked about and you talk about all the time. Then we have, a lot of women, young girls start on birth control pills, which completely throws off your hormone balance. Even though a lot of people think it's for hormone balance, you're actually getting higher levels of synthetic hormones than you are in hormone replacement therapy. So, you had that diet, hormones, stress, lack of exercise, just the exposure that we have now to external sources of estrogen, like plastics, PVC piping, pesticides, soap, clothes, DDT, which we absorb, into our bodies.
It's one of the reasons that women's breast cancers and also male prostate cancer is becoming more obvious and more apparent and than any other time.
Yeah, and recently I was reading an article talking about how many toxins are found in the umbilical cord of a new baby. It's like over 200. It's insane how much toxic exposures that we have in our body and that we pass on, not knowing, not intentionally, but just through our environment.
So children aren't even being born pure and clean like we would hope that they are.
Oh, you want to get me started on kids now?
No, this is about women.
No, but
We'll do women today.
But it does start, in infancy. I mean, a lot of kids are given soy formula. Soy is the most genetically modified food that we have. Not to mention, we know that giving children soy at an early age especially is going to create more of an estrogen progesterone imbalance. So, I mean, there's a multitude of reasons why we have infertility, why we have polycystic ovary syndrome, and all of these, low libido, all of the sexual dysfunction problems that are out there. There's a lot of reasons why we are where we are now with that.
My guest in studio, Dr. Jennifer Sims, who will be your host this Wednesday evening at the Roselle Center for Healing. Dr. Jennifer is an expert on female problems from a holistic point of view, structural, chemical, emotional. Let her help you put your life back together, ladies, without having to depend on drugs, without seeing your bones become brittle, without, having to suffer through the symptoms of insomnia and fatigue and depletion and so forth. Give our office a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Jennifer Sims' presentation this Wednesday night, Uniquely Feminine. That'll be at the Roselle Center for Healing. We're just off the National Capital Beltway on Route 50 in the Red Cross building. 703-698-7117, and how you find us here is 888-630-9625. Dr. Jennifer, let's talk about a group of symptoms that drive women into physicians' office as they approach that menopause age. It's like all of a sudden the body stops working and they have thyroid problems and they have weight gain around the middle and they can't get it off. Their memory pattern goes out the door. They can't sleep anymore. They have no energetics. What happens?
Well, I think you just told us what happened. They're a hot mess. They're just miserable, and they've done the traditional route, and typically it will get them to a certain place but not maybe hold them long term. With all of the debate now about to get on hormone therapy, to not get on it, usually those conversations are had in the perimenopause state, when you're done having kids or you think you're done having kids, and you start noticing the insomnia and, like you said, the weight gain, the fat that starts to come on the belly and the thighs that you just can't get rid of.
That's cortisol weight.
Yeah, the cortisol weight. All of that has to do with stress, but also hormone imbalance. What a lot of people don't realize is the adrenal glands that make cortisol are the secondary hormone producing site in the body next to the ovaries in a female, and then after that would be the fat cells. So the more stress that you're under, the more you're going to have a hormonal imbalance. And the more it's going to be manifest in all those symptoms like not being able to sleep at night. When you're stressed, your cortisol usually spikes when it's time to go to bed, it spikes instead of going down. You get all of these crazy symptoms. So
if you get a woman who's in her 30s and you had to do an interview with them and predict, are they going to have problems, or are they going to go through this process, perimenopause and menopause, more easily? What would be the check marks? What would give you the idea, this lady is going to have some problems unless certain things change? What would they be, if you had to pick a handful of things?
Oh, definitely diet, definitely job or home stress, whatever they're doing, if personal stress. Honestly, that really, the emotional side of the triangle that you talk about all the time really is profound, especially when it comes to hormone imbalance. Their exposure to toxins, what they do for a living, where they've lived, if they've lived here or overseas. There's lots of things. How long they've been on birth control pills, if they've had infertility problems, if they've had, cystic breasts or cysts on the ovaries often.
How about trauma and injury to the body? Does that cause any shift? Does that cause any problem whatsoever?
Sure it does, and depending on where it is, if it's head trauma, it's going to be significant. So there's tons of things that you can scan on a person's health history to kind of determine which way they're going to go when they enter this stage of life. But there's a lot of things that you can do so it goes really smoothly.
Well, the reason I brought up trauma is about a week or so ago I had a woman that come in, and obviously it's been my experience many times over a period of 35 years or so, that she had been in a car accident 10 years prior, and after the car accident her period stopped completely. And she now is about 49 years old, so it was late 30s. And everything stopped abruptly, and she went into a traumatic menopause type of situation. Well, all of her physicians told her that it was a stress pattern. And because of that stress, they said emotionally, because of the injury, the upset, and so forth. And what we found when we examined her, and I'm asking if this is your experience as well, is that during the accident, she had significant trauma and blow to the head, locking, as we know, the cranial plates, shutting down the normal pumping mechanism, normal rhythm, if you will, of how the body initiates hormonal production. And fortunately, we've treated her in a very short period of time, and she started spotting again. So I think we're going to be able to restore function, not for a long time because of her age.
Yeah, and I mean, cervical and head trauma is significant too. If there was a mechanism where she had a concussion, all those things matter. I mean, the hypothalamus is in there, the pituitary is in there. We know that's the conductor, right, of the beautiful orchestra, the symphony that deals with the adrenals and the thyroid and the testes and the ovaries and how everybody talks to each other. So there's a lot that goes into injury. And hormones, absolutely. And not just hormones, but a lot of other conditions.
We're going to get into that much more in depth. We're coming up to a break, but this Wednesday evening, I know you're going to get into a lot of these things in detail. And ladies, if you're having problems with your hormones, if you really like to know how to manage it, take your life back, get control, get rid of a lot of these symptoms without having to be dependent on medication for the rest of your life, this is a class that you need to attend. Call our office at 703-698-7117 and tell them that you want to attend Dr. Jennifer's class on Uniquely Feminine this Wednesday, the 25th of February. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625, 888-630-WMAL. That's how you find us today, and how you attend Dr. Jennifer Sims' presentation this Wednesday at the Roselle Center for Healing. She's going to be talking about Uniquely Feminine. Ladies, if your hormones are out of control, this is your opportunity to get your life back. Wednesday, the 25th February, at our office, 7:30 p.m. Call 703-698-7117. That's 703-698-7117. Dr. Jennifer, welcome back. Let's talk about estrogen and progesterone imbalance. And because we see so many problems today, we talked about xenoestrogens a little while ago, and you said because of our exposures environmentally today, estrogens are going through the ceiling, which shifts the situation to the place where there's no balance. And physicians give their patients estrogens to maximize their femininity. The problem is that they need to have balance in the system, and they're actually creating a disaster, because the more estrogen that you have in the body, the more likely it is that you end up with cancer problems. So talk to us a little bit about the necessity of that progesterone estrogen balance that should be there for everybody, by the way, not just women.
Well, yeah, you pretty much just said it. I mean, you need to have a balance, and when you're taking estrogen unopposed by progesterone, I mean, the studies are there, even the medical literature, the Women's Health Initiative, we know, even before that, estrogen unbalanced without progesterone or estrogen imbalance will increase your rate of cancer. There's no gray area on that. And the longer that you have a situation where you're estrogen dominant or you're taking estrogen from an outside source and it's not balanced with progesterone, you're setting yourself up for uterine breast cancer. My favorite thing is putting women on estrogen without progesterone. I say this sarcastically.
Mm-hmm. Absolutely.
And they don't have a uterus, right? So the doctor's like, well, you're not going to get uterine cancer, so don't worry about it. I'm like, do you have breasts?
Yeah, do you have other tissues in the body?
Do you have other
too?
tissues in the body? Like, it's just, it cracks me up how cavalier and how it's not important. And it is important.
And what they
do you
don't
have ovaries? Just, you've had a hysterectomy, so you'll be fine.
And what they don't realize is that estrogen, unopposed, is cytotoxic.
Yeah.
To all kinds of tissues
to all
in the body.
kinds of things in the body. So, you need to have a balance. And, there's 3 different types of estrogen that your body makes, and each one is really important depending on the stage of life that you're at. We're actually really uniquely made. And so running to hormones to fix things typically isn't what I recommend. That's usually the last resort, because a lot of these hormone imbalances can be addressed through diet, through exercise, through lifestyle change, before you run to a pill, a patch of cream, to think that's going to fix your problem.
One of the things that we've been talking about but haven't mentioned specifically and kind of skirting around the edge with diet, but there's a problematic organ system that a lot of people overlook, and it's called the liver, because the liver is responsible for so much transition of hormone stimulation of others. It's a organ system that denatures, breaks down all kinds of hormones, particularly estrogens. And if it's toxic, if it's polluted, if we have dietary patterns and exposures that are overwhelming, that system can't do its job. So it begins to trigger the toxic levels within the receptors for all kinds of hormones within the body. You have to start cleaning those things out.
Yeah, absolutely. And that's why I said it's important to rule out and go through those body systems and mechanisms before it is to run and get yourself on a cream, because Suzanne Summers said it's great.
Yeah, I know. How about,
we're so much more complex than that.
How about things like black cohosh and chasteberry and those herbs that many women will see an ad say, well, this works great to balance estrogen and progesterone. Take this, and are they at risk when they start adding those things to their diet?
I think that it's definitely a better choice than going to the traditional things, but it's certainly, dealing with the symptom, the hot flash, whatever they're going to it for.
You're still covering the spot in the rug.
Yeah. So I do think they're nice things to add once you are working with cleaning up the liver and the diet and getting exercise and getting rid of waste appropriately and all that kind of stuff. I think they're definitely a better thing to grab when you're having a meltdown, because I don't want to minimize things. When you feel like crap, you feel like crap, and you do sometimes just need something to get you through that bad time. So I'd much rather see women go towards those things versus something more synthetic or something potentially more harmful, but recognizing that, you're just still masking the symptom of a bigger problem.
Our number here is 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about female hormones today. Dr. Jennifer Sims is my guest, and will be your host this Wednesday evening, the 25th of February at 7:30 p.m. If you'd like to attend that presentation and learn in detail what you can do to change your life, give our office a call at 703-698-7117. That's 703-698-7117. There's so many patients that come into our office, Dr. Jennifer, and complain that they have these issues, these problems, and so forth. And they say, well, what herb can I take? What can I do to balance this out? And as you began to draw the conclusion is that it's just not about taking an herbal supplement. Herbs are meant to rebalance the body, but you have to go to the place of why is it? What happened initially? What was the reason that it took place? So, what...
So you have to do a little homework. You've got to start researching yourself and figuring out why is it that you are where you are in this moment, and start doing the right testing. You start doing some blood work for thyroid. You see, is my thyroid shutting down? That has a direct effect on your hormones. Is it my liver? Is it my digestive system? Is it my adrenal system? Do I need to see if my cortisol levels are doing what they're supposed to be doing? So you actually really need to do some accurate testing first to see where the breakdown is in order to use things like herbs and supplements and nutrition, but you don't just start reading something and say, oh, I have these symptoms, so I'm going to take this. Because long term, you're masking the problem and you're creating another problem in the interim.
We are in studio. My guest, Dr. Jennifer Sims, who will be your host this Wednesday evening at the Roselle Center for Healing. Dr. Jennifer is going to be speaking on Uniquely Feminine. Ladies, how to get your hormones back where they need to be no matter what age you are. You shouldn't be going crash, boom, and depleted. You should be sliding into life at every stage. Very lovely, very uncomplicated. But unfortunately, in this end of the world, we don't do that too easy. So give us a call, 888-698-7117. 703-698-7117. Want to remind you that the rest of this month is a month dedicated to women. Thermography Centers of Fairfax office only, is offering full body examination, including breast examination, for $400. Normally $475. Take advantage of this. Start your year out with a full evaluation so you can see things happening before they become critical. Infrared thermography will show the beginning stages of vascular formation, the blood supply to where mass will begin to form years before you're going to pick it up on mammographic exam. Give them a call, 703-943-7248, and make your appointment today. This Wednesday evening, again, the 28th, February, 7:30, Dr. Jennifer Sims will be your host and my guest today in studio. Dr. Jennifer, before we get into fertility, we have some callers, and I'd like to take one. Carol, how can I help you?
Hi. I was on estrogen test. It was estrogen and testosterone and progesterone for 23 years. The doctor took me off it, and a year later I had breast cancer. And my theory is that that's what caused it, because the body was deprived of it, and so it was hunting around for it.
No, that's not the case. So what happens is that unfortunately, and I don't know what prescription you were taking relative to the dosage. I don't know how your body's functional capacity was as limiting some of these things. Estrogen by itself, as we talked about earlier, is cytotoxic. And unless it's balanced very, very carefully, you're going to increase your risk to breast cancer, uterine cancer, and so forth. Now, when you go into a perimenopause and menopause state, your doctor, if they decide that there's no other way of getting you to ramp up normally, and as women should and are designed to do, then the estrogen levels that they give you should be very low. Because if you're not going through the childbearing age, you don't need a lot of estrogen. That's the primary reason estrogen is there at high levels, is so that you can conceive. But when you're no longer at that place, then your body's levels of estrogen should stop. You shouldn't stop producing estrogen. You should have estrogen in your body, but it also has to be balanced equally with progesterone. Testosterone sometimes is necessary, but sometimes it can cause other problems in combination with estrogen. Again, I'd have to know a whole lot more, but my opinion, Carol, is that, see, the thing with breast cancer, the beginning stages of breast cancer don't just suddenly happen within 6 months or a year. They've been building up for a long period of time. It's been something that's been developing slowly, and probably 5 to 8 years before that. So you have to take a look at what's taking place in your life, your exposures, other things that would initiate ultimately the development, then the presentation. So just because you stop taking the estrogens, you're not going to say your skin tissue is not going to suddenly develop that breast tumor, that breast cancer. So I'm not sure that, again, I can't give you all the data because I don't know enough about you. But that's my opinion, Carol.
Okay, thank you.
Thank you for calling. I appreciate it. 888-630-9625. Dr. Jen, you can jump on that, or let's go into fertility.
Let's talk about fertility. You had asked me what causes it. There's lots of things that can contribute to it. Obviously, there could be, something anatomically wrong, which typically isn't the problem. But typically what we see are people with very stressed out adrenal glands. People with back problems also, you can't underestimate the power of the nervous system in fertility. There's been many women over the years that I've been practicing that I have seen firsthand. Once they start getting spinal manipulation, it turns on the lights to the ovaries and the uterus and the hypothalamus and the brain, and things start working. So adjustments and getting the nervous system up and running definitely makes a difference. And usually there's been an injury. So an injury pattern can create a scenario of infertility, bad car accident, sports injury, gymnastics, whatever, in the lifetime that hasn't been addressed. There's true hormone imbalances. I mean, like we've talked about, estrogen, progesterone, testosterone imbalances, problems with the pituitary gland, problems with the ovaries. You know, there's lots of things. Premature menopause. I mean, we can talk about infertility all day.
There's a great refereed journal called the Journal of Manipulative and Physiological Therapeutics, JMPT, that has had many articles over a decade on the effect of spinal manipulation and the outcome of fertility, but also on the outcome of difficult periods and perimenopause and so forth. And the data is there. It's very straight up. It's very documentable. So if anybody would like to really research that and find out, are these guys really talking from their left hip, or is that stuff out there? It's a refereed journal, Journal of Manipulative and Physiological Therapeutics. Go find it, and you'll be amazed how effective that spinal manipulation, particularly with women who have a history of low back pain or have had injury to their spine, or have trauma of any sort, and trauma can shut systems down completely, and all of a sudden there's nothing functioning, there's nothing working.
Right. So yeah, you can't rule out injury. So we have to look at all of those things. And typically we get a lot of women that do have infertility issues and have done the IVF and IUIs, and I don't know all the acronyms for everything, but they've been through a lot, and they desperately want to conceive, and there's so many things that we can at least rule out to see possibly why they're not conceiving.
There's an old herb that I've used for many, many years. It's called chasteberry, and it's used for fertility problems. Years ago, it was for women who were starting to approach that transition time where physicians typically didn't think that they were too fertile. But it's used for a woman where there's an imbalance in estrogen, progesterone, and the daily dosage of chasteberry differs depending on what the problems are and how they match up. But chasteberry raspberry leaf infusion helps prepare the uterus for birth, and it can be drunk as often as you want. It's not a big deal. But chasteberry extract, the tincture, is the thing that is the most effective that I've found over a period of time, in combination with all the other things that we do in our practice. So, Dr. Jennifer, let's kind of take the next step with this fertility problem. In my experience, and as it's been yours, you turn the lights back on and things start working the way that they're supposed to work. How about a woman who comes in and, she's in that menopausal time frame, she's going into transition, but she's starting to become extremely osteoporotic. How does all this match up with women's hormones getting skewy?
With osteoporosis, you're looking at all kinds of things, because we know that you do need to have adequate hormone balance to make bone cells. We also know that, once again, the amount of calcium, magnesium, vitamin D, all of those things make a significant difference in osteoporosis. We know how important vitamin D is to the immune system and to the hormone system. So there's a whole other thing you can look into, another test you can do to see what is going on with those systems in the body and how we can help them not get to osteoporosis, which typically I personally, because of my population of practice, don't see many osteoporotic patients, but I do see a lot of osteopenic patients, that's the step before osteoporosis. And we even see that in children now, sadly, because of all the high soda consumption, the sugar, the phosphoric, the carbonic acid, pulling the alkaline phosphatase from the bones, creating a depletion in the minerals in the bones. So, it's really, really significant as well to address that.
Well, one of the things that you also see is because the adrenal system gets depleted, and its effect ultimately on the thyroid, because you have this crazy thing called the HPA axis, the adrenal system, or hypothalamus pituitary, and the pituitary affects the thyroid, and also the adrenals affect the thyroid. But there's these little organ systems within the thyroid that a lot of people forget about. It's called the parathyroid. And the parathyroid gland is the king in controlling calcium metabolism and bone metabolism relative to calcium. And we forget about that often, and we forget about how that axis works. And it's a stress pattern and has to do with all the things we talked about. Let's go to the phones. Nathan, thank you for calling. How can I help you?
Hi, just calling with something that I want to share with you, and then you can share your observations or comments on it.
Okay.
My sister-in-law and a couple of friends that we know personally have all had this experience where they were unable to become pregnant, and then after doing an herbal cleanse and getting their body pH to a more alkaline state, they were able to become pregnant.
Absolutely.
As a matter of fact, we have one friend who was on birth control and did the herbal cleanse for another reason, and then became pregnant because it seems to apparently have just cleansed the birth control stuff right out of her system.
Well, let me tell you why that works more so than anything else, Nathan. It's because in so many different situations, particularly with birth control pills, it causes an inflammatory reaction within the body, high acidity, and you end up with receptor site incompatibility. It means that the receptors will not receive enough hormone and be able to balance itself so the woman can't get pregnant. So once you shift the body alkaline and you detox the body, meaning that you clear the liver, you clear the lymphatic system, and your body's at a better place now that everything can kind of kick in. It's like, getting the corrosion off the spark plugs on the battery in the car. And once you start doing that and you turn the switch, now it works. And that's
right.
That's the same type of thing. So what you're dealing with is a toxic reaction. The hormones are doing the same thing that we know the term insulin receptor problems. So the receptors are now blocked because of inflammation and because of toxicity. And once we lower the inflammation, whether we're doing it through a cleanse or we're just shifting dietary patterns or we're upregulating, anybody that's in pain is going to have inflammation, then the body starts working. Absolutely right, and I appreciate you sharing that with us, Nathan. Thank you very much. That's right up our alley, kiddo.
Yeah, and he's just reinforcing what we've been talking about. And the liver's toxic. Liver makes and manufactures cholesterol. Cholesterol is a precursor to all of our steroid hormones, progesterone, estrogen, testosterone, and all those wonderful things. So if that's not working well, we're not going to make hormones very well. We're not going to clear them very well. So that's great. That's a good testimony that doing a good liver cleanse, hopefully under supervision, created some new babies.
Yeah, and one of the things that I see in the practice, and I know you do as well, is that when we start messing with fat metabolism in our body, when we start messing with cholesterol and we try to get it down around our ankles, when we get to the place where we avoid fats in our body, hormones don't work, period.
Hormones don't work, and neither does brain chemistry. There's been a lot of data showing abnormally low levels of cholesterol. Everyone's all worried about high levels of cholesterol. That low levels of cholesterol actually will contribute to depression and anxiety, which ultimately will kind of mess up your chances for getting pregnant if your body's so emotionally stressed out. So there's a lot of factors. Like I said, you got to do the testing, you got to do the work and figure out, well, why is that versus, well, I just want that. Because that's the problem. We all just want stuff, but you have to work to get it.
We start messing with the body. There was an interesting article that was on the news this morning, caught my attention because it seems to be popping up everywhere, and it's something that you and I have said for a long time. When people have heart disease or they want to prevent, there's so many physicians out there saying, now you turn 50, you got to take a baby aspirin every day the rest of your life to prevent heart disease. Well, I'm telling patients, and I have been for a long time, don't do it. You're crazy because you're causing all kinds of other problems. And one of the things that it causes, I've told patients, is bleeding. And when you have areas that are irritated and inflamed because of putting an NSAID, a non-steroidal anti-inflammatory, within the body, that causes, by the way, a rebound inflammatory process. So here's what they came out with, Dr. Jen, today. Today's news this morning. In the Archives of Internal Medicine, okay, the magazine of all the White Tower gods, they said that aspirin use does not measurably help cardiovascular disease or prevent heart attacks. And in fact, the side effect that they're very, very worried about now is that it's causing, guess what? Bleeding.
Anemia.
Yeah. and the patient's B12 and iron levels are going down the tubes.
Shocking.
Unbelievable.
Not so much. I mean, this is just, physiology. Yeah, you're absolutely right. But once again, just like everything else, it will fall on deaf ears. And people will still say you need to take it, just like people still say, well, cholesterol is what causes heart disease, and we know that's not the case either.
No, I keep telling people
but people are still coming in on their statins because of their doctor saying their cholesterol is too high, and they're worried about heart disease. And I'm just like, does anybody read their own literature anymore?
No, and we sit there with these because we have a very educated population around this area. And
our patients actually are amazingly educated to the point where I'm like, wow, they keep me on my toes.
Yeah, they ask questions.
Yeah.
And I asked them, do you ask your doctor this too? Do you challenge them like you challenge us? And it's great for us because we don't dare slip. We have to prove our positions, and that's a good thing. It's a good thing for them. It's a good thing for us. It's a good thing for all of our listeners. But, you really have to take control of your own health. We want to make an offer, and I'm going to talk a little bit about it when we come back after the break, is that this coming February, the Roselle Center for Healing is going to do something called Have a Heart Day, and we're going to ask you to help us raise food for those who have nothing. We do this every year just before Valentine's Day, and we're going to tell you more about that. My guest in studio, Dr. Jennifer Sims, will be your host this Wednesday, the 25th. 7:30 p.m., talking about female hormones. Call our office at 703-698-7117. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. I kind of jumped the gun. I'm sorry, Rick. I didn't see you pointing at me, and I thought you already were there. 888-630-WMAL. That's how you find us every Sunday at 12 noon. My guest in studio, your host this Wednesday, the 25th, Dr. Jennifer Sims. We're talking about female hormones. She's going to be talking about, ladies, how those hormones need to be balanced in every stage of your life, what you can do about them naturally, what makes a difference, what doesn't, the things that you might be setting yourself up with different types of drugs and medication. It's really a class that I would encourage you to not miss, simply because of the fact that you're supposed to live well, vibrantly. There really shouldn't be any ebbs and flows and bangs and cracks along the way. But unfortunately, in this society, that's what we suffer. So give our office a call at 703-698-7117. Began telling you before the break that on February the 12th, Sunday, in that entire week, we're going to be hosting something called Have a Heart. Those of you who have never been a patient of the Roselle Center for Healing and would like to come in and see what we might be able to do for you, we're going to take away all the obstacles, but we're going to ask you to help us. On that week, February the 12th, all of my associate doctors are going to be opening up their schedules to examine and consult with you at absolutely no charge, only for that week. But what we're asking you for is an exchange. Our normal examination fee is $225 to see one of my doctors for an examination consultation. We are going to waive that if you would give openly a donation to Caring for Others, which will be donated to Food for Others in the Fairfax County area. And not only that, but Caring for Others, the foundation that we work with, will match your donation. So whatever you give, either in food or in financial contribution, Caring for Others will match that. So if you'd like to schedule an appointment, when you call in for Dr. Jennifer's presentation this week, 703-698-7117, tell my staff that you would like to have a full examination with one of my associates, either acupuncture or chiropractic examination. Our gift to you for helping us help those who are less fortunate and who are so needy and have nothing. Dr. Jen, let's talk about what you're going to talk about this Wednesday evening. We only have a few minutes. Unfortunately, we're going to leave some calls on the board. We may get to one before we're done, but let's wrap it up. Let's be concise about it.
We're going to talk about what hormones are, because most women don't even know what they are, where they do, where they come from. Most people don't. We're going to talk about the different stages of the premenopause, perimenopause, youth, whatever you want to call it, all the different stages and hormones in a woman's life, testing, nutrition, all the things that you can do, depending if you have a problem or you just want to come to prevent having a problem. there's going to be a lot, and it's open to really any stage of life. This is not just for menopausal women. This is not just for women with infertility. It's for women in general, just to get some education.
This is an educational process that we present to you, our gift to the community, every other week on different topics. This one is a topic that, ladies, really you should be there. How to prevent it. Don't go into that perimenopausal and menopausal process thinking that you're going to have hormone substitution, thinking that you're going to be less than what you were when you're young, thinking that it's the downslide to the end of your life, because it's not so. And we would like to encourage you, we would like to have you there as our guest. Dr. Jennifer Sims will be your presenter. 703-698-7117. Give us a call. We'll be more than happy to answer every question that you have, and I think you're going to find it fascinating. Those of you who have heard Dr. Jennifer speak before know she's dynamic, she's bright, she's capable, she's able to put it all together for you. We're here every Sunday bringing you the most up-to-date information on alternative health care on every subject that you can imagine. This is Dr. Tom Roselle. See you soon. Bye.